Dr. Suchak. Sir, you have been at the site of major flood-affected areas where people are dying, they're really losing homes, they're losing livelihoods. Really, if we think about it, they are losing everything that they build in their lives. At such point, when you see them sort of hoping for that another life to hold on to. How challenging has it been for you and the teams working at flood affected areas?
Yeah. Thank you, Isha. It's a pleasure to be talking to you today at the platform of Alive. I would like to mention first that during any relief work, you are not ready because this is absolutely sudden. Either it's an earthquake or it's a flood. We have to work with whatever medical supplies we got. We cannot expect the facilities of a hospital in a place where there is earthquake or something like that. So we have to manage with absolutely minimum things. And you know what I had the experience was that the energy comes automatically, organically. It's fantastic when you are on a mode of helping the victims of either earthquake or the tremendously. I would first start with Latur. It was 1993. You know, when we got the message that there's a big earthquake, I remember it was the 26th January. I was on a school platform giving a talk, and there the earthquake vibration came. And then I was told by my wife that there's a big earthquake and, come back home fast. So when I reached home, we decided to travel from Bombay to Latur immediately with a team of doctors from here. And in about few hours, almost like 12 to 14 hours, we reached Latur. Latur was very drastically damaged in the sense the houses had collapsed, the people staying there had absolutely, compressed with the walls and everything. So when we reached there, we realized that we need to look for a place where we would put up our tents or work. On the way from Latur to Kilari, Kilari was the most affected place. So we were told, go to Kilari, there is not enough help. And when we reached Kilari, we saw some people putting up tents. As soon as we talked to them, it was being put by the army. So I spoke to the commanding officer. Okay, we are a doctor team and I run a hospital in Bombay. So how can we? He says, please join. We need manpower. We need doctors. We had surgeons. We had orthopedics, 12 doctors and about 6-7 people and 2 ambulances. So the relief work started right there at Latur with the army. And we almost worked for almost a month over there. First was to identify patients who were very serious and who had multiple fractures and who could not be managed to be operated in those tents. So we had to shift them to the civic hospital. Civil hospital was there about 15-20 kilometers away in our ambulances. First stabilize them, then send them there. Other patients with minor injuries, we could manage over there. But it was such a draconian this thing. Lot of children, lot of women, they were brought out dead from the rubbles of earthquake. So it was, very, very ghastly appearance, and all the villagers were working. The government help was still not there. Army people and the surrounding villages who were not damaged that much, they all came for the rescue, and the work started gradually of shifting people from there. And then after almost we shifted those patients who needed operation at the civil hospital. Our surgeons, our orthopedic surgeons, they were operating day and night, 24/7. You will not believe we had to collect bottles of blood because there was no proper blood bank. So we managed to set up we had a pathologist who would check the things, and, at that time we did not do all those tests of hepatitis and all, and just collected blood because we wanted to save the lives. So all those people who were in hypotension or lost a lot of blood were given blood, Hemaxil and other injections, and we could try and help many, we could save many lives over there. But the scene was very bad, and we realized the civil hospital there did not have the ICU. So when we finished our relief work, I came back from Bombay, collected funds, and we set up one beautiful ICU for the local people there. That was at Latur. In 2001, in the earthquake of Kutch, we were near a place called Bidada. We went to Bhuj. I knew some collector at the central government, so I spoke to him. We have a team of people, we want to help, so how do we go? So he said, you first reach to Bhuj, meet the collector, and he will guide you where the help is required. And then we reached the place called Bidada. Bidada had small hospital, but they had no enough staff and surgeons and all. So all our orthopedic surgeons, anesthetists, medical specialists, all, and the way there was almost like 100 villages around, and the patients were brought in those hatgadi and cart, bullock cart and all, and in bad shape, all damaged structures and absolutely. So we set up those tent, and outside we started giving intravenous fluids, and with all the, you will not believe, I had some interns. They were doing work of the
Ayas.
Ayas, and we were not thinking everything. We had to give part, everything. We changed their clothes, and it was, and again, like working 18, 19, 20 hours. There were no lights. So they had arranged a generator for the hospital, and generator would only work for say 6, 8 hours, 12 hours. Again, give a gap of 1 or 2 hours, would put up the diesel and again start the generator. So that is the way we were working there. And it's unbelievable sight. It's unbelievable sight. There also we had to collect blood from the donors, help the hospital there, and all those. There were a lot of serious compound fractures. Compound fractures means the bones had come out of the skin and all. They were compound fractures. They could not be operated there. So I requested, why not shift them to Bombay? So Indian Airlines, they agreed. They removed the seats of the plane. In each plane, we put 12 patients. Those 12 patients, like in a day, we were sending 2 flights. And I took responsibility of 60 patients in Bombay. I have a hospital here, about 70-bedded hospital. We admitted all those patients here. And all my team here also started working. And it took 3 months for doing all those multiple surgeries. Could be orthopedic, then plastic, and everyone became perfectly all right. When they were fit, we sent them back to Kutch. In the meantime, a lot of people realized good work is being done. So a couple of friends, they sent some donations and all. I realized end of couple of months, I could take up a village to rebuild a village. So I went and met the collector. He pinpointed a village of 100 houses. So we rebuilt 100 houses there. We made a small primary school again and a hall. And, it took almost a year and a half. In the meantime, they were given those temporary huts and all, and we provided them ration for that village for about 1.5 years almost. So that work was unbelievable. You have to, feel the pain of the people, and then that compassion which you have to help. We are fortunate to do all this work, and saving of life is most important as far as our profession is concerned, or reducing somebody's pain, even that.
Absolutely. So very well mentioned by you that it's not easy at a point like that. And you also shared a lot about not just working at the moment, but really building on life from there, holding your victim's hand and taking them to the happy end, so to speak. Here, I'd also like to ask you, sir, you mentioned how with very few resources, all of you all work. When communication is not at its best, how are you dealing with various teams at hand, be it army, be it the local government, be it your teams? How are you really connecting to see what is the best that can be done for patients, and what were you doing to make sure that at that point in time you can help the patients that need maximum attention? How are you really prioritizing?
See, 93 Latur, there was no mobile phone. I remember we had something like radio. This thing was there. You know, those people would go from one set to the other set. They would communicate. That's the way. It was very difficult at that time, and we had to send people by vehicle. But Latur, Kutch was comparatively easier. The mobile phones were still working. Some of with the generator they could set up. We had to go to Bush to call people, say about 40 kilometers away, and we started getting health and medical also. Those blankets and lanterns and torches and chadars, and we got more help also. We got more volunteers in a couple of days. So that started, so we could divide the work otherwise later on, because it becomes very difficult with less human resources to get to everyone. And I remember a child also who was removed from the house after about 2.5 days. It was almost 1.5-year-old child. And child was crying, dehydrated. He got tired of crying also. And then when they removed, we had to first give IV fluids to, check out everything. There are, injuries and all. And then when we gave some IV fluids and all, gradually that child, came around. We were very happy to see that. So such cases we see in such circumstances. And it's very, very satisfying in a way. But we, as a doctor, feel that the facility of areas, small rural places, are not adequate. In cities we have everything. Towns we have got second, the towns we are still better off. But small villages and all, where there are some primary health centers, there may be doctor, there may not be doctor, but not enough facilities. So we have to move those resources from the cities to that place.
Thank you so much.